State of Alabama has a shortage of about 3,000 doctors.
But starting Tuesday, a new law will be in place to try and get more into the mix.
News 19's Emily Mosner digging into this and joins us now in the studio with the latest.
That's right. The Physician Workforce Act will go into effect on August 1st. The Alabama legislature passed it earlier this year, and the governor signed it into law back in May. Now, the Alabama Medical Association says it will pave the way for more doctors to start practicing in the state.
There's a shortage of physicians in the state of Alabama, and anything we can do to increase the number of physicians and the quality of physicians in our state will be a service to our citizens.
The new law will establish an apprenticeship-like program for medical graduates who don't match into a residency program. They will be able to start working while training under a licensed physician. The president of the Alabama Medical Association says this will help since there are typically more medical school graduates than there are residency spots.
A young physician, it takes them a year or two to obtain a residency slot, and we don't want to lose those doctors to other states because where the physician trains the majority of the time is where they settle.
The Alabama Medical Association says 20% of the current physician workforce is made up of international medical graduates. The law will allow international medical graduates to apply for a license 1 year sooner.
They could actually start working in urgent cares and ER shifts in some of the hospitals after 2 years because they would be able to obtain a state license.
It will also be easier for physicians from other states to start practicing in Alabama. It eliminates the knowledge exam that is currently required.
I think what the state's trying to do is be more in line with other states. I think they're trying to reduce that extra red tape. We'll still have standards that are consistent with other states in the across the U.S.
The chief medical officer for the Huntsville Hospital Health System, Robert Chappell, says Alabama has a high number of people living with chronic illnesses, and having enough doctors to go around is paramount.
Patients often don't have somebody to go, can't get access to either a specialist or primary care, and they end up in the emergency room.
Again, that new law goes into effect on August 1st.